So before we get into the session, there is a note to the attendees. So dear attendees, you will also have an opportunity to interact with the expert speaker and get all answers to all your questions. You can also post your questions in the chat box or else you can raise your hand so that I will allow you to speak. So without any further delay, let's dive into the virtual sea of knowledge and exploration. Greeting and a warm welcome to everyone joining us from the various concerns of the digital realm. So today we are going to discuss about the topic become a cardiologist without NEET PG. So Ms. Rajeshwari is here to elaborate the topic. So over to you, Raji.
Thank you so much, Kalai. Good evening, everyone. So welcome every participants of doctors here. And here I'm going to undergo webinar of become a cardiologist without a NEET PG exam. And before that, I want to make sure that for every doctors, whether my voice is audible. If I'm audible, would you please in the chat box, if you message me yes, so that it will be easy for me, so I can know that my voice is audible for you. Yeah, thank you so much. And just I want to have because we can have a discussion, doctor. Most of the doctors who joined here, I want to know how many of them or have completed your PG, or is your graduation is only MBBS? If it's MBBS, kindly message me that you have completed one day MBBS, or any of you has done a PG. Please mention me in PG what type of specialty you have done. Thank you so much, doctors. Like I can see here, doctors has done MBBS. MBBS. Yeah, thank you so much. So I want to know, I think, hope you doctors are preparing for the NEEPG examination too. I think so, which is coming for the 11th August. Okay, doctor, it's very good to hear. So I want to know, have you attended the previous webinar of cardiology, or this is the first time you are attending this webinar? No. Thank you, Dr. Abhishek. Is very good. This is the first time, Asim. Thank you so much, doctor. I can see a very quick response from you guys. It's very, thank you so much. Here I'm going to we can go with the topics. So here we can see become a cardiologist without NEET PG exam. How come? Like how a doctors can pursue a cardiology without a NEET PG examination. So here we can see yeah. So here, I want to let you know the intro of what is cardiology first of all. So here you can see cardiology is dealing completely with focusing on only the heart, like how you're going to treat your heart disease. And it is a crucial role which you will be identifying with the patients, you'll be diagnosing, and you'll be treating what type of disease they'll be having, such as coronary artery or a heart attack or heart rhythm disorders, infections, and more on. Okay, so this is the basics of cardiology. So just I want to know from the participants, according to you, what do you feel? What will be the cardiology? So according to you, doctors, what do you think in this? Because as I told you, cardiology is completely dealing with the heart. Okay, so as being a doctor, what do you think the cardiology will be mean by? Okay, fine. Okay, doctor, I will take care of it. So, doctor, when you say, as I told you, right now, what is happening in the world scenario is people are undergoing with the aging of populations right now, and there is an increase in completely in a cardiovascular disease, and the lifestyle is changing completely. Yeah, thank you so much, Dr. Abhishek. You have given cardiology study of physiology, pathology of the heart. Yeah, definitely it is a right. Okay, which is completely right. And thank you so much, doctor, which you have given derivation of the cardiology to me. And right now, when you see in the world, not only I'm speaking about India, I'm speaking about across the world. What is happening is the population is increasing. We can see in India, almost we have 1.3 billion of population has been increased, and the cardiovascular disease also getting increased, and lifestyle of the people is changing daily basis. So there is an increase in the heart related issues is occurring, and there when you go with any of the private hospitals or corporate or government hospitals, definitely you can see n number of patients in the cardiology department. But when you go and see in the cardiology department, you can see a doctors will be very, very, very minimum. Okay, to treat the patient. Why the doctors are very minimum in cardiology? Why the patient is very high ratio in all over the country? That reason I'm going to give you right now. Okay. So there are certain types of cardiology technique is available. So most of the doctors will be aware of the cardiology technique. So these are the cardiology techniques where you will be using in your cardiology department, and you'll be with this particular techniques only. You will be treating the patient also in the daily basis, or in the part of the how much patients are coming into the respective hospitals. The one will be coming as the electrocardiography, which is a ECG, or we call it as an EKG. So that is to record the electrical signal for the heart. For the heart beating, they use this particular electrocardiography. So the second which comes is the echocardiography, which is very, very important. Echocardiography, like everyone knows, that is a sound base of an which creates a picture of the heart, which where doctors will take a common test that will show blood flow through the complete heart and heart valves. So that doctors will use this echocardiography. So when it comes with the blood pressure of stress test and Holter monitoring, which will be detecting for your heart rhythms, doctors use this particular Holter monitoring, and you can see the cardiac catheterization. So cardiac catheterizations, like which we otherwise we call it as a cardiac cath lab also, which is a medical procedure used to diagnose and treat the heart condition, like was coronary angiography, angioplasty, nuclear cardiology, pediatric cardiology. There are different types of cardiology techniques which will be available. So these type of techniques, when you see doctors who's pursuing the cardiology, they will be established to be used in the respective hospitals. So with these techniques only, doctors will be dealing with the patients, and they'll be giving the reports also. Okay. So here we have come to one of the scenario. I told you in the previous one of the slide, I would have given you a clear, I would have asked you one of the question is like, why? Okay. Why cardiologist doctors are very, very minimum in India? What is the reason? Why doctors are very low? The second one is why the patient is very, very huge number, okay, in all over the country. Okay, the main reason, when you see, you can see the seat, this is the complete seat for cardiology specialty which I have been provided to you. So here you can see completely the total colleges or hospitals all over the India. You can see only 123 colleges, which is for only cardiology specialty I am mentioning, not for the other specialties. The total seats you can see, which is like a DM or a DNB seats, when you see, it comes around 510 seats only will be allocated for the cardiology doctors. In that, when you see, when you go for NEET SS, like when it comes like how a doctors will become a cardiologist, like first a doctors want to finish your MBBS. After that, they will do super specialty. I will explain you in the upcoming slides. Okay, so right now I will give a small intro about the cardiology seat here. Here you can see a doctors will undergo a NEET SS. In the NEET SS, when you see, a doctors need to get the NEET overall score should be 318. Okay, but the closing NEET SS score will be 197, which is all Indian quota. The management quota, when you see, the starting NEET SS score will be 280, but the closing NEET SS score is 152. So these are the particular score you can see directly. And what is the government quota tuition fees? If you get selected in the government colleges, definitely your fees will be coming around 20,000 to 90,000 definitely. But when you get selected in the management quota tuition fees, doctor, please look into that. It's really a huge number. It will come up to 47 lakhs for a cardiology specialty. If you choose for a NRA quota tuition fees, it's definitely 58 lakhs. It's a real report. A private medical colleges will definitely will make you, or you will be giving this much fees if you're not like attending to that level of score, which is asked for the NEET SS. Okay. Why the cardiologists are completely demand in India? I would have asked you in one of the slide why cardiologist doctors are very, very minimum, and why the patient is high. Here you can see very good. I would have given a very brief and clear explanation here. The cardiologists in India are having a severe shortages. The reason is like when you see in India and many of the countries, our lifestyle has been changed, our food has been changed, everything has been changed. In a daily basis, we can see towards one of the Instagram, or towards one of our YouTube or whatever the channel daily basis. When you see mobile or any of your friends, they will give an instruction that you should eat this much of foods, or you should change the lifestyles. So everything on daily basis, every peoples are giving an instruction, but 90 percentage of peoples are not following it. They're opposite to the what the people say. Only 10 percentage of peoples are following it. So when a 90 percentage of peoples are having a different life cycle stage, if they're not following it, what will happen automatically is the heart attack. They'll have a stress, anxiety, depression. Okay, if a person is working in one of the corporate or any of the organization more than 12 hours, 24 hours, if they're not eating properly, what happens? Completely into the stress. They get a cardiac arrest, slow by slow level. finally when we are approaching to the doctors, what happens? Doctors will definitely say you have a cardiac arrest, you wanted to angio. Okay, if not, we'll treat the patient through the medicine. So everything is happening in the current world. Is what is happening is the cardiovascular disease has been increased to 28.9% has been increased completely. The risk of Indian citizen has been increased. So the demand for cardiology is completely the aging of population, high level of health problem, the supply of constraint in cardiology, shortage of cardiologist doctor. I will definitely give you the one of the best reason why the shortage of cardiologist doctors are very, very low, and high concentration of employed cardiologists, ancillary services of offerings like shift of cardiac procedure to outpatient settings, attractiveness of cath lab and research services. These are the cardiology demand. So this is one of a journal of the American College of Cardiology Doctor, which have taken it from one of the best journal, which is really approved. Here you can see like a cardiovascular disease. It's a leading cause of mortality in the United States and all around the world. And an American dies from CVD cardiovascular disease approximately every 42 seconds. Every 42 seconds. It's from India or like from abroad countries, that is for sure. And I want to know, like in your chat box, you can type. So doctors, like I want to know, are you currently working right now? If you're working, would you please mention me? Are you working in a private, corporate, or in a government sector? Yeah, sure, doctor. Definitely, I will come to the point because I know that you're also preparing for your NEET PG examinations. But why I'm giving you this much explanation, the reason is like you will be coming to one of a conclusion why I'm saying all these things. Okay, because this will be definitely will be useful for your career one. Okay, because I'll come to your point also, because then you will know why I have given this much of explanations. You're told that you're not working. Why I ask this question is like most of the private or corporate hospitals where you're working, you can see the patient flow. Okay, how much death is causing in terms of the cardiology. Okay, so as like one of the doctor asked, I will come to the point also. The doctor, like here I'll give a very good explanation. India needs completely 88,000 cardiologists, but therefore we have to 5,500 cardiologists which is available today in the country. Today with the population of 1.3 billion, there is only one cardiologist for a 30,000 population in the country. You can see for 30,000 population, we have only one doctor, only one cardiologist. So there is a vacancy of 88,000 cardiologist doctors in India. And do you want to know average salary of cardiologist doctors you get? So like as you told doctor, they're preparing for NEET PG examination. Just would you please mention me in my chat box, what is your dream branch that you want to get into that, so that you're preparing for your NEET PG examination? Medicine. Okay. So any other doctor? Would you please let me know what special general medicine? Okay. So as you know, you're preparing for your your internal medicine specialty, which is for a 3 years of your PG of your career. Definitely, I know after finishing your internal medicine, do you want to choose a super specialty as a cardiology, DM cardiology? Yes or no? Please give me a chat box. Definitely yes. Okay. Yes. Thank you so much. And I want to have one small question is like, uh, this is your first time that you're going to give your NEET PG examination, or already you have given a NEET PG examination to get into this dream branch of your general medicine? It's the first time. Yeah, it's really good. Okay, so the first time of your already given the examination. Yeah, thank you so much, doctor. So here, why I ask this much question is, I'll give the real scenario. You told me that you want to choose internal medicine and you want to choose a cardiology as a DM level. So here you can see the average salary of your salary also I'll mention you. The normal Indian average salary of a doctor will be beginning in the career is 5.4 lakh. That's a normal salary. Based upon the state by state, the salary is differing. And MBBS doctor with a 5 to 7 years of experience, he will get 4 to 7.5 lakhs per annum as a salary. The average salary of a doctor across the world 9.6 lakhs. For government doctors, it also vary. But when you see if a doctor choose as a clinical cardiology, if they pursue a program clinical cardiology, and if they complete the program, what is the salary right now is from a 2 lakhs to 40 lakhs with an average annual salary of 18 point lakhs per annum is your salary. Because why I'm saying this much it is, my student who has pursued the clinical cardiology with the Texila, they're getting a salary of per month, it's of 2.2 lakhs per month. In a yearly basis, they earn around 18 lakhs more than that. That is the real salary of our doctors who's doing this clinical cardiologist. The only one reason is like because the cardiologists are very much in the demand. As I told you, ratio 30,000 population, only one doctor. Okay, you can see how much salary a private corporate, or if you go for a government sector, if you're in a hospital, how much salary you can expect, doctor. You are the leading doctor itself. This is the real salary which I'm sharing you. And this is a salary if you want to work in abroad countries as one of a cardiologist, you'll be getting a salary in this particular ranges. If you choose like USA, definitely you will be like $140,000 will be a salary. If you choose like UK, it'll be 125,000 pounds is a salary. Germany is 90,000 euros. Dubai will be 49,000 dinar. Australia will be like 1,38,000 Australian currency will be there, and as well as Canadian dollar will be 2,30,000. This is your salary if you're like expecting for a cardiology if you want to work in across the countries. Okay, this is like one when you see the 28.1 percentage of death in India due to the cardiovascular diseases, and cardiovascular diseases in a daily basis, you can expect a 4,000 to 4,500 cases in the hospitals. It's like of if you choose for an ischemic heart disease, means 1,050 to 2,000 cases. It definitely you can expect in a daily basis. Strokes 475 to 550 cases. Rheumatic heart diseases 550 to 674 cases you can expect, because even when you run your hospitals or when you're working in a private or corporate sectors, you can expect these patients will be available in your respective hospitals. Okay, so as like one of the doctors asked me, like why exactly I'm sure because you're preparing for the NEET PG. Because the reason, ma'am, you can prepare. I'm all the best for your NEET PG examination, but this will be your life-changing moment after you're trying your NEET PG examination. Definitely, 100% I'm saying. See, I'll give a very brief explanation for you. As being an MBBS graduate, I think you completed 5 years. Okay, with internship, 5.5 years. Okay, one of the doctor told you that you're going to attempt first time. The other doctor, like I think you're going to you already attempted your NEET PG examination, and right now you're once again you're going to try your examination. All the best for every doctor who's trying for the NEET PG examination. If you get selected for the NEET PG examination, I'm very happy for you, doctor. You can finish your MD very soon for a 3 years, and you can undergo your NEET SS super specialty, and you can finish your DM cardiology. In any case, for example, I'm saying, in any case, if a doctors, because this is for common doctors, I'm saying, like if any of the 50% of doctors is not able to crack the NEET PG examination, okay, what is happening? The real scenario is you spend your MBBS as a 5.5 years. You started working. What will be your age right now? Exactly. Would you please put into the chat box whether your age will be like 25 to 30 or like 30 to 35? In between it'll be like of 25 to 30 level or like 30 to 32. No, doctor, like I'm not speaking about an MRCP. It's completely related to the cardiology program. Okay, because this is completely dealing with the cardiology specialty only. Yeah, so right now, doctor, I'm asking right now. So right now, for example, I'm saying might be your age will be in between the ranges, like 20, like 25 to 30 ranges. Oh, of course. So between yours, okay, fine. So 25 to 30, 20, 26. Okay, this is your age limit. Okay. So I'm giving us real scenarios. Right now, for example, I'm saying like 25 to 30 ranges means you you're into the NEET PG currently. If you get selected, I'm happy. As I told you before. In any cases, what happened is 30 doctor. Okay, for example, I'm taking as a 30 ages. Okay. 30 let it be. If you choose an MD, if you're trying for an NEET PG once again, repeatedly, next is going to come. Next will be very one of the toughest examination. So doctors, if you're trying more than 2 times, 3 times, 4 times, what happens? 34. The age is increasing. Okay. The demand is increasing. We'll have very huge competition in the world, and being a normal medical officer is not possible. Right now, you want to be a specialist. Okay. So here, when you see doctors being an MBBS, after that doing an MD, DM, this is like 11 years. Why I mentioned this is for a doctors who's clearing the NEET at a time. Only one attempt. I have said this. There's another scenario, MBBS. If a doctor is trying a 2 to 3 times the NEET PG examination, getting your MD seat again 3 years, and most of the doctors have seen, like in the real 2024 report, what is happening is most of the doctors have quit their MD program in between, sudden break of their stress level in the certain hospitals and medical colleges. That also has been happened currently. Okay, so what is happening? I think most probably if doctors are trying an EPG 3 to 4 times, pursuing their MD, after that sitting with a NEET SS and clearing the NEET SS, after that DM cardiology, definitely it takes to become a cardiologist around 45 age, around 45 age or 48 age, doctors will become a cardiologist at the time of 48 age. Okay, so here what is happening is you can see the patient is dying in a daily basis. We have lots and n number of patients, like 4,500 cases without a cardiologist doctor, they are dying. Okay, so the demand of cardiologists is really increasing. And when you choose, if doctors choose a DNB, okay, I will choose a DNB. I don't want MD. I will go for DNB means there's a DNB, the passing ratio also is only 15%. It's not like 10 to 15% is the passing ratio. And getting a seat in of a DNB also is very, very difficult ratio after MBBS and DNB 8 years. So to make it very easy, our Texila University to save the peoples in India and to bring a n number of cardiologists, we have introduced a program as a fellowship in clinical cardiology, where after finishing your MBBS within the 2 years of duration, you can complete this clinical cardiology program. The top affiliated hospitals, the top branded hospitals, you can pursue this program. So here, why there's a shortage of cardiologist is like less number of seats. Total DM seats is only 510. PG need qualification, longer period of study, low DNB passing ratio, as I mentioned you, only 10 to 15%. These are the main reason for the shortage of the cardiologist in India. So how our program will be giving a life to the many cardiologist doctors in India is like no NEET PG is required for us. We will not, you don't need to give any NEET PG doctor. Okay. Completely hospital based teaching, flexible location. You'll be trained under a top DM cardiologist. Even when you get a DM seat, also, most of the colleges, the doctors will not be able to post you because of your NEET SS score. Okay. And many of the doctors' ambition will be that I want to work under Dr. Neerajan. I want to pursue under Dr. Vinod Sharma. I want to pursue under this much doctor so that I will get a good hands-on experience that will be helpful in my career. I can run my hospitals. Okay. With Texila is giving you that opportunity. Under the top DM cardiologist doctors only you will be trained. They will give you excellent clinical knowledges in all the department of cardiology. You will be expertise and you will be a cardiology. Like when you join in our affiliated hospital, you yourself will feel that you're a cardiologist. Like that, the hospital's training will be there, and you'll have an attractive stipend while pursuing the program. A dedicated student mentor from Texila will be given to you and will be appointed for you. A faculty support from the hospital and university will be given to you. The examination will be semester wise, and theory plus practical will be taken for you. A pathway to masters. You can have a master's also from our end. So these are the hands-on training which is given in our affiliated hospitals when you pursue this fellowship in clinical cardiology semester-wise. Cardiology wards you'll be posted, cardiac ICU emergencies you'll be posted, stress test, Holter monitoring, echocardiography, pediatric cardiology department. So these are the departments semester-wise you'll be posted and you'll be getting a hands-on experiences. You'll be dealing with the patient face to face. Okay, you cannot say no, ma'am. It's like an observership, but so that will not have an hands-on training like that. Not like the 100% hands-on training. In every department, you'll be posted and you will be getting. So these are our partner hospitals. You can see in Andhra, like we have this much hospitals. In Gujarat, we have this much hospitals. And even Mumbai, Delhi, Faridabad, Ghaziabad, Bangalore, Kolkata. So these are the hospitals. In these hospitals, when you say Ramesh Hospital, Usha, Anu, Aster, Yashoda, or like of very good reputed hospitals in these locations, they give a very good hands-on training. In Gujarat, Bankers, Rhythm Sterling Hospitals is a very famous there. And Mumbai, Delhi, Faridabad, Ghaziabad, Bangalore, Kolkata, you can see like Metro, SSB, Yashoda, National Heart, Kalra, Holy Family, Trinity Hospital and Heart Foundation, Decent, Pathya Hospital, Mumbai, Medicare Hospital, Mumbai are the very good reputed hospitals and they are ready to teach you and train you. So, would you please give me the chat box? Like, do you know anyone of these hospitals, doctor? I do. So, which hospital you know, doctor, from the list which I've shared you? Holy Family. Okay. So, okay, fine. So, would you all of the AP and Telangana hospitals also you know? Okay. So, from this partner hospital, which hospital do you feel that is really very good? Because already you know, except for Aster Prime. Okay, 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 fine, doctor. Okay, so I think recently the Aster Prime has a new update also. Okay, because we have a new one of the CEO has come to the Aster Prime hospital, so you can expect a very good level of training in Aster Prime hospital from this 2024 year also. Okay, and Holy Family also hospital. Like, what do you think about the Holy Family hospital, doctor? A small feedback about Holy Family hospital because you know Holy Family, so that is the reason I asked you. It's nice. Okay, fine, doctor. So as you know, right? So because when you see these much hospitals are ready to Ramesh Ashoda or accurately the most reputed hospital. Yeah, definitely, doctor. 100% sure. These two hospitals are really very good reputed hospitals. Okay, as I told you, when you choose this cardiology, these are the hospitals you will pursue. You can choose any hospital from your end, like whatever hospital you want, you can choose, you can pursue. They are ready to provide you the training. If you show them the 100 percentage that I'm here to learn, they will teach you 100 percentage guarantee. All is great in Holy Family. Okay, 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 fine, doctor. Okay. So, like when you see, so this much like hospitals, when you see it, they will give you a very good learning doctor. They will make you a cardiology within the 2 years of period as a clinical cardiology. And as I told you, there's a choice of salary also. 18 lakhs per annum. You can get around as being a cardiac specialist. Okay. And when you, as you told that you have a dream of medicine also, there's a chance. If you get NEET PG, you can go MD or DM cardiology for sure. In any cases, if you're not able to crack NEET PG, please join this clinical cardiology 2 years. I'll give you an idea also. After finishing a 2 years of cardiology, even you can pursue MRCP, like as one of the doctor told me, told right now. I think you're speaking about MRCP, like the same doctor. Okay, after finishing the cardiology also, you can even undergo with your MRCP examination. Why don't you try after finishing the cardiology MRCP? Because MRCP is completely a theory pattern of examination. MRCP is hard, but it's not like that. MRCP is not that much hard because what I'm saying is like one of my doctor Kritika, she cleared MRCP. Okay, so there's a difference, doctor. There are 5 students giving their MRCP examination. Okay, then that 5 student, if 2 doctors are clearing, if 3 doctors is not clearing, it depends upon how they study and how they like keen into their ambition. Okay, like as you many of the doctors told me that your real dream specialty is medicine. I'm here for the several field. Okay, I've spoken with many of the doctors, many people. They'll have two specialty as a dream branch. They will say pathology is my dream branch. They will say gynecology and internal medicine, radiology, surgery. So when you see a doctor need to choose only one as a dream branch, they should not have a two as a dream branch. Only one. So as you told, your ambition is only medicine. So you are giving a preparation for NEET PG is to get into your dream ambition as MD, which is internal medicine that you want to pursue. Okay, the same as MRCP doctor. MRCP is not that much easy. I will absolutely give promises like if a doctors are clearing an EPG, 100% you can clear MRCP. It's very, very, very easy. It's only depends upon your mind only. Okay, if you feel okay, I can clear. I'm capable of clearing. If I clear, I will teach to 5 students. I will make them clear. You are the MRCP graduated student and you are the MRCP professor, you can be an MRCP guidance to the so many students. You can think in that way also. MRCP is not that much easy. It's only depends upon our brain and our mind. If doctors are trying a 3 to 4 times an EPG examinations, I will say you that please try MRCP examination. If doctors are failing 4 times in EPG, I'm giving you 100% assurance. MRCP you can clear it in first attempt. It's not that much easy. If you prepare, the main thing is a guidance, doctor. If you have very good support, if you have very good guidance, okay, definitely you can clear the examination. Because if you're preparing an EPG, it might be in your self study or a person might be guiding. Likewise, MRCP, if you have a support, if you have a guidance, definitely you can clear it. Okay. So the other way, as I told you for cardiology, and you can see here, this is a 2 years of cardiology. Many doctors, rather than trying the NEET PG, wasting their time, they join this clinical cardiology. They finish it, right? Most of the doctors completed itself. Okay, most of finished itself. They are working as a clinical consultant cardiologist or non-invasive cardiologist, most of the top hospitals. I think one of my doctor cardiology also, he cleared his MRCP part 1 and part 2. He finished cardiology. After that, he done his MRCP because he don't want to waste his time. He don't want to waste because in this tough competition world, doctors are in the race. So you want to prove, you want to do a specialist 100 percentage. It's your choice, doctor. Okay. So don't think MRCP is hard. If you join our university, doctor, I will assure you, doctor. Okay. I will make you prepare for sure. Okay. I will make you clear the examinations with my MRCP faculty guidance itself. I'll make you clear. If you have a faith in me or if you have a trust in me, definitely after the NEET PG examination, you can connect me. 100 percentage, doctor. Let us work. Okay. Let we both work. I'll make you clear. Not webinar is not about an MRCP. It's completely a cardiology program because you asked me like the reason is like you told me that examination MRCP is hard, but that is the reason like I've given you the clarification. The MRCP is not that much hard, and the webinar is completely cardiology. And why the topic is MRCPs? It's like after finishing the cardiology, you can do MRCP because as you told that your dream branch is internal medicine. MD medicine, right? So that is the reason I told you after finishing a cardiology specialty, even you can pursue an MRCP to achieve a major specialty. Okay. So normally this cardiology will give you a really a good lifetime career for your doctors. Okay. And even I will let you know with another the testimonials I'll share you of my doctor. Here, Dr. Sujitra Nehar, okay, like he's a student of our Texila University. He completed our cardiology program with our university and he given a very good feedback or he stated that the faculty is really great. He's right now working as a non-invasive cardiologist in the top hospitals. Dr. Ramesh Yadav, he's also one of our doctor who completed from Narayana Vardalaya from Jaipur. And he's also like working as a non-invasive cardiologist in top reputed hospitals. Likewise, we have many doctors, okay, Dr. Hema Agarwal, Dr. Keetesh, like that. We have many multiple graduated doctors who are working as a specialist in a different corporate or the private sectors. And if you want to have a discussion with our students, okay, with my student who completed cardiology or success in their career, definitely I will make you have a talk with them directly so that I would like want to know like if you have any queries or anything you can message me and kindly please share me your number, email ID, and what are the queries you have so that we can have a discussion like directly too. So do you have any queries, doctor? Of course, doctor, please message me your the fee structure of the program, everything will be updated to you directly. Okay, so whatever queries like you can message me, our advisor will be connecting you directly and they will be guiding you for the fee structure of the cardiology program and the hospitals and the admission formalities, everything they'll be guiding you. Hi, Dr. Pinkesh Agarwal. Thanks, Dora. Thanks for joining. Like any hospital in MP, no doctors. Like as I mentioned earlier on our slide, we have hospitals only in these locations. I will share you once again. Doctor, like Dr. Pinkesh, like these are the hospitals, doctor. Sorry, like we don't have an MP. We have only in like of completely in Mumbai, Delhi, Faridabad, Ghaziabad, Bangalore, Kolkata, Gujarat, Andhra Pradesh. So I think like you can even choose like of Faridabad or like of Delhi location also of Kolkata to pursue the program. Definitely, doctor. As I told you, I will really happy so that I can even make you speak with the graduated doctors from TAU. So that I think you shared me your contact number. If you please share me your thank you so much for email ID. Our concerned advisor will contact you directly and they will be guiding you completely, doctor, okay, regarding admission formalities. And we will make you speak with our graduated doctors so that will be definitely for your life changing of your career. So if you have any other queries or any other doubts, you can even message me so that I will be helping. The other doctors also, you can just pin me your contact number, your email ID, and your query. So our concerned advisor will be connecting you directly, and they will be a fee structure. Definitely, doctor, sure, definitely, the fee structure will be updated for you by our concerned advisor. They definitely will reach you, and they will update you what is the fee structure for the cardiology program to decide further. Definitely, the fees will be affordable, doctor. No worries. Okay, for this clinical cardiology, we bring because this is not only for the doctors. We're doing this program. It's completely for even for many of the patients because they need a guidance of cardiologists right now in India. Okay, so that definitely the fees is completely affordable level only. We will be giving you an definitely stipend is available, doctor. When you are pursuing this program, the stipend is 100% provided to you because you pursue a PG program. Stipend is there. Regarding the stipend and what is the fee structure exactly, our advisor will connect you independently. Individually, they will connect you. They will guide you with the fee structure, stipends, and all other details with the queries. And one of the doctor has informed me also that you want to talk to graduate doctors of TU. Definitely, sure. Of course, doctor. We'll share you the graduate doctor's number once after your admission formalities has been completed. I will guide you for sure. Any other queries, doctor? Apart from these doctors, like if you have any other doctors have queries, please post me so that our advisors will reach you. Apart from this is like, so doctors, do you have any other queries? Hi, Dr. Ravi. So the 2 years fees course stipend will definitely will be updated to you by our individual advisor. Would you please update me your email ID and contact number so that our advisors will reach you and they will update you regarding your stipends and as well as your fee structures, everything. And would you please fill the feedback also, which is shown in this webinar? No other queries, you guys. Of course, doctor. Thank you. Thank you so much. Thank you for joining. I'll be like our advisors will be connecting you individually, and what are the queries you have. Definitely, we will guide you all of your queries. Okay, I hope everything will be very good, and all the best for your NEET PG examinations too. Thank you so much.
By this, shall we end the session, Raji?
Yeah, definitely.
Okay, so attendees, the polls has been launched. You are requested to attend the polls. A big virtual thank you to each and everyone for making us webinar a grand success. Thank you for the participation, doctors. Thank you, Raji, for your presentation. So by this, we will end the session.
Thank you so
Yeah,
much.
thank you.
Yeah, thank you. Bye.
Bye.
Bye, Doctor. Bye, everyone. Thank you for joining.